For 10 years now, the Centers for Disease Control has been studying gun deaths as a public health risk, and that has touched off a controversy within the medical community. Some doctors say the problem is crime, not guns. Others say the CDC should continue work at its National Center for Injury Prevention and Control. We want to talk about that this morning with Dr. Jerome Cassirer of the New England Journal of Medicine. He joins us from WBBM Television in Chicago. And in Los Angeles, Dr. Timothy Wheeler, Director of Doctors for Responsible Gun Ownership. Good morning to both of you.
Good morning.
Good morning.
Dr. Cassirer, perhaps we could start with you. How is this a public health issue and, instead of just something that should be in the realm of law enforcement or politics?
Well, for some time now, the Institute of Medicine made a report some 10 years ago that injuries and of all kinds should be centered in one federal agency, and the decision was made some time ago to center that at the Centers for Disease Control, where research can be coordinated and where programs can be developed, and that has worked quite effectively now for several years.
But Dr. Wheeler, you're opposed to this research because you feel that there's an agenda here?
We believe there is. Certainly, some of the important research that demonstrates the positive side of responsible gun ownership has been left out. In addition, we have concerns, two concerns about the National Center for Injury Prevention and Control. One is that they engage in political advocacy, and the other is that they use tens of millions of tax dollars to do it.
Right. So, Dr. Cassirer, do you believe that this is hard scientific research, or is it motivated by some sort of political agenda?
Well, in fact, these research studies undergo several layers of evaluation. They are evaluated first when an investigator begins the research. They are evaluated later by the National Injury Center. When the proposal is made, they are then evaluated by hard-nosed reviewers when the paper is submitted for publication. And I view these studies as sound. In fact, if you look at them, they're basically epidemiologic studies, and we have to appreciate the fact that epidemiologic studies of populations take some time to develop a strong hypothesis. If you look at the relationship, for example, between cigarettes and lung cancer, it took years before that relationship was quite solid. And I believe that we're finding similar kinds of data in these studies.
Dr. Wheeler, it's certainly difficult to separate politics out of this debate, but people who are watching this right now might be wondering how anybody who has taken the Hippocratic Oath could possibly be opposed to any organization looking into ways of lessening or controlling violence by firearms.
We certainly agree that violence, the problem of criminal violence, must be worked on in this country. Our only difference, I believe, with the CDC is how it's to be done. Now, Dr. Cassirer has mentioned epidemiologic studies. I would like to show you an example of how the CDC has strayed far from scientific issues. I have here a newsletter from a gun prohibitionist organization in San Francisco. This newsletter was funded by a grant from the Centers for Disease Control. When you read the newsletter, you will see advice on such political activities as how to organize a picket of a gun manufacturer and advising people to work for campaign finance reform in order to reduce or weaken the impact of the gun lobby. That is their language.
Quickly,
we believe that tax dollars should not be used to fund this sort of thing.
Fortunately, gentlemen, we're both out of time, but this debate is certainly going to go on. Dr. Cassirer in Chicago, and Dr. Wheeler in Los Angeles, thanks for being with us this morning. Appreciate it.
Pleasure to be here.